Pandemic, sadly, was fairly predictable, and it won't be the last pandemic. The next one could be far more severe.
There's been an outbreak of the deadly Nipah virus in India.
Europe is being urged to tighten border checks for travellers arriving from India after an outbreak of the deadly Nipah virus.
UK health officials have issued a health warning after cases of the deadly Nipah virus were confirmed in India.
Experts are calling for stricter border measures as concern grows over the Nipah virus.
Thai authorities are stepping up monitoring measures following new confirmed cases of the Nipah virus.
I mean, this one, it killed millions. It was awful. We got the vaccine. Actually, President Trump's leadership was a factor in getting that out quickly. And so when I spoke to him, I said, okay, here's some other medical innovations, including a thing called an HIV cure that could be accelerated. So, we should be more prepared.
This is a highly contagious virus between humans, and it's often deadly. The 2 cases of Nipah virus were detected in India in the state of West Bengal, but there are concerns the outbreak could spread. The virus has a fatality rate of 40 to 75%, according to the World Health Organization. So it's deadlier than the COVID virus, and there's no vaccine for Nipah. So authorities in India are taking no chances. At the same time, several airports across Asia, in Thailand, Singapore, Malaysia, Hong Kong, they're taking steps to screen passengers for any symptoms. Nipah is a zoonotic virus that's transmitted from animals, usually fruit bats. It doesn't spread easily to humans, and it can also come from contaminated food. But when it does, it initially hits like the flu, then worsens, and experts say pneumonia and other respiratory symptoms can develop. But the most serious complication is encephalitis, or inflammation of the brain.
We'll have to prepare for the next one. That, I'd say is will get attention this time.
This outbreak is at the center of global interest. Meanwhile, at the forefront of the laboratory diagnosis of the hantavirus outbreak linked to the MV Hondius cruise ship is the medical scientist heading the Center for Emerging Zoonotic and Parasitic Diseases at the National Institute for Communicable Diseases, the NICD. Dr. Jacqueline Veyer and her team spearheaded the laboratory diagnosis and lifted the veil on what the world now knows with certainty is the Andes variant of hantavirus.
It was not a working day, it was the Workers' Day weekend. So it was the 2nd of May, I got a call, we were actually on a hike in Pretoria, and I had a discussion with one of the clinicians, and they were telling me what they're seeing, and we were talking through the possibilities. And we decided that we're going to be testing for hantaviruses, because this may be hantavirus of pulmonary syndrome. So got in the car, drove to Joburg, got into the lab and started doing the tests. And within a couple of hours, we were able to give the doctors the results they needed to start actioning the management of the patient, because the results helps the doctor to sort of hone in on what they're dealing with and how they should be dealing with the patient, but then also starting to communicate with the Department of Health so that we can trigger the containment responses for the bigger outbreak.
This was an unusual and unique laboratory diagnosis on South African shores, yielding scientifically led, informed decisions that steered the subsequent global public health response.
So it's unusual because it's the first time that we're actually diagnosing a case of hantavirus of pulmonary syndrome in South Africa. Previously, we've had investigations for other hantaviral diseases, mostly the ones that you will be finding in the European context. So this was a first for South Africa, but we're always ready for the unlikely. That's our business in this particular laboratory. So the investigation itself, not necessarily unusual, but the outbreak is certainly unusual, a very rare condition. And then the whole outbreak scenario on a cruise ship, that's not been reported before either.
Categorized by health experts as zoonotic diseases, these are infectious diseases that can be transmissible from animals to humans, including from rodents.
So there are many different hantaviruses. I'll talk specifically about the Andes virus, which is the virus that's causing the outbreak or has caused the outbreak on the cruise ship. So this is a virus that's transmitted by specific rodents in different South American countries. It's not found in South Africa, it's not found on the African continent. It's transmitted from these rodents to people through close contact, either through bites, but also through contact with the infected feces, urine, and saliva. And then with Andes virus, unlike other hantaviruses, you can see transmission from human to human, but at a very low rate. It's not a highly infectious virus.
Some of the symptoms that have been associated with hantavirus may sound familiar to many people.
So hantavirus initially presents very similarly to flu, influenza. So typically, viral infections that give us muscle aches, they can give you headaches, fever. Some people might even have some gastrointestinal symptoms like abdominal pain and diarrhea.
However, she cautions that the Andes variant is distinctively unique, describing vital factors that set it apart.
What makes it very different from viruses like COVID or influenza and then respiratory viruses we're used to is it's not as infectious. If we look at person-to-person transmission of the hantavirus, it's generally prolonged contact and close contact. If you think of somebody sharing a household or partners in a household, long, prolonged periods, just walking past somebody or being in the same room transiently is not how it spreads.
She also elaborated on the case management of patients once hospitalized.
There's no specific antiviral treatment for hantavirus or the Andes variant, so treatment is really symptomatic and supportive. As soon as it complicates with respiratory disease, that's when you want to be in an intensive care unit, might require ventilation, oxygen.
With sobering COVID-19 lessons still fresh in the mind, the global health community has since intensified efforts to respond to health emergencies with more precision.
So there's been lots of lessons learned as well, and we've learned from actually mechanisms that were set up. And as you also do know that legislative instruments, like for example, we had the international health regulations that were amended of 2000, that were amended based on the learnings from COVID. We also had the pandemic agreement, the first ever landmark agreement that was actually approved by member states last year.
The IHR is a legally binding framework that functions as a global early warning system for countries to practice coordinated international response efforts to public health events and risks.
For example, we had the IHR, International Health Regulation, focal point persons of the different countries that were actually now having to sort of deal with the hantavirus itself. Then, for example, we had South Africa, Cabo Verde, the UK, the Netherlands, because of course this was a ship linked to a company within the Netherlands itself, and the European CDC and so forth. So all these coming together to be able to have a coordinated public health response. Of course, WHO provided the technical support to the South African government, specifically the National Department of Health.
Health experts say the widespread misinformation regarding the hantavirus outbreak, coupled with public fears described by many people as reminiscent of the COVID-19 pandemic, are concerning and far from the truth.
In South Africa, we don't have endemic hantavirus, and one is always concerned that people are going to panic around any rodents, thinking of guinea pigs and pets being returned because people are scared of the hantavirus. Not all rodents carry hantavirus.
It's nothing like COVID. It is not as transmissible as COVID. So what does that mean? It means it doesn't spread so easily.
The myth about, there's going to be lockdowns is not correct, because we are not dealing with a situation which has gone out of control and cannot be managed.
Whilst the hantavirus outbreak is alarming, health experts have emphasized that it is nothing like what the world experienced with the COVID-19 pandemic. Zandile Mieza, SABC News, Johannesburg.
Turn over to our next update. We have some breaking news first coming in from Africa, where the United States government has announced sweeping emergency public health precautions to block the international spread of the deadly Ebola virus. In a joint order enacted today, the US Centers for Disease Control and Prevention, alongside the Department of Homeland Security, implemented mandatory enhanced travel screening, strict entry restrictions, and a temporary suspension of visa services for travelers originating from outbreak hit zones in East and Central Africa. The rapid American response follows an emergency declaration by the World Health Organization, which officially labeled the rapidly escalating outbreak in the Democratic Republic of Congo and neighboring Uganda a public health emergency of international concern. We'll, of course, be bringing you all the updates coming from that developing situation. But we head back over to the Gulf, where the Qatari Prime Minister, Sheikh